The pandemic has caused more anxiety and depression in our community. But at what point should you seek help for yourself or a loved one? And what do you do? The Thurston Mason Behavioral Health Administrative Service Organization, or TMBHO, is an organization that supports county residents during behavioral health crisis and connects them to recovery support services. Their medical director, Dr. Keith Brown, is here today to talk about their services in times of COVID. Well, hi, Dr. Brown. Thanks for joining us today.
Thank you for having me.
How did your organization adapt to continue services during this pandemic?
The Thurston Mason Behavioral Health Organization focuses on addressing mental health crises throughout the Thurston Mason counties. And we have actually encountered roughly a 25% increase in crisis calls and mental health evaluations during the period of COVID. One of the things we've done to adapt is to have an increased focus on telemedicine. So a lot of patients are now being seen through the internet rather than being seen in person. A lot of people in crisis are actually coming into the emergency room rather than being seen in the community. So that resulted in an increased rate of emergency room visits as well.
Wow, even in spite of the fear of coming into an emergency room because you might get COVID, that's pretty astounding.
Correct. Mm-hmm. And also, it turns out that one of the things we've had to do is talk about which services are considered essential services that have to maintain face-to-face contact during the era of COVID, and which services can reduce or shift into telemedicine and have less face-to-face contacts during the pandemic.
And you said there was a significant increase. Did you say 25%?
The Thurston Mason counties have experienced about 25% increase in crisis calls and crisis evaluations. We roughly deal with about 2,500 calls per month. Now, nationally, the data from the National Institute of Mental Health indicates that the rates of depression and anxiety have actually increased roughly 3 to 4 times during the pandemic.
Wow. And then that's going to be compounded during the holiday season. Is that correct? Is it true that you see more mental illness during the holiday season?
Yeah, so correct. So even in a regular period of time, the holidays are a period of stress for many Americans. First of all, there is the stress of cooking, the stress of holiday parties, the stress of entertaining, buying gifts. Add to that the fact that you have increased unemployment, increased financial stress. Many families have lost loved ones, whether due to COVID or some other cause, and the holidays can be a painful reminder that those individuals are no longer with us. In addition to that, we have social isolation, and we have kids and parents forced to be together more hours per day. So those relationships can be quite strained, and we see increased incidents of child abuse and increased incidents of family stress. So all of that kind of put together with the usual holiday blues, and on top of that, we have the pandemic. And then a third phenomenon, which we've already kind of known about for years, is what's called the seasonal mood disorders. So in the Northwest, especially where we have low light conditions during the winter, we know that there are increased incidences of depression during the winter months.
So people need to be aware of this and take precautions.
Agreed, yeah.
Mm-hmm. What are the signs that someone should seek psychiatric help?
There are a number of signs. Number one, symptoms of depression can include changes in sleep pattern or appetite. So people with depression, about 75% of the time, they will have a diminished amount of sleep, but about 25% of the time, they may have excessive sleep. There can be changes in appetite, particularly a loss of appetite. Some people actually gain weight during a period of depression. Irritable mood is a core symptom of depression, and also what we call anhedonia, which is a fancy word for saying that activities that are usually pleasurable are no longer pleasurable. I used to like to go to the gym, and now I just don't enjoy that anymore. I used to like to go to be with my friends, but now I don't enjoy that activity anymore. People who are depressed may have difficulty concentrating. They may have low energy. They may have low self-esteem and feelings of worthlessness. And sometimes they may have thoughts of suicide. So suicide can be a lethal outcome In fact, for people who have severe depression, up to 15% may die by suicide. So one of the things that we look for in people who need help is we look for trying to get them somewhere where they can receive professional assistance. One of the aids that we teach in what we call mental health first aid is the acronym ACE, A-C-E. A stands for ask. If you think someone in your family or someone who's a friend or someone that you work with may be suffering, you can ask. There's a myth out there, well, if I ask, I'm going to put the idea into his or her head and make them think more about suicide. That is a myth. People who are thinking about suicide have already thought about suicide, and asking can be life-saving. It doesn't plant the idea into their head. So A stands for ask. The C stands for care. It's important to show empathy for people who are suffering. And E stands for escort. You don't leave someone alone when you suspect that he or she may need help, particularly if that individual could be suicidal or thinking about suicide. You don't leave them alone. You help ensure that they receive a safe escort to an emergency room or to a crisis evaluation where mental health services can be provided.
So if you notice this about yourself, some of these things, you're not getting as much sleep, if things you used to find pleasure in are not pleasurable anymore, what do you do? How do you find help?
There's a number of ways to find help. First of all, people can call a crisis hotline. So in the Thurston Mason region, we have a couple of major resources. We have the 24/7 crisis hotline, and the number for that is 800-270-0041. We also have the Crisis Clinic of Thurston County. That number is 360-586-2800. You can reach out to your primary care physician. You can reach out to a community mental health center. Sometimes you can go to an emergency room and they can suggest resources as well.
Does TMBHO provide help to family members too?
Yes, through our contracts with providers, we recognize that people rarely exist in isolation. They exist in the context of a family. And that's especially true for children and adolescents who need mental health services. So one of the principles of care is that when you're treating an individual, you have to address the needs of the entire family.
And where can a family member or a close friend find group support?
There's a number of resources through community mental health centers, in particular, NAMI, which is the National Alliance of the Mentally Ill, actually has a special focus on meeting the needs of family members who may be coping with mental health challenges among someone in the family.
Okay, so we've discussed depression, anxiety, and that's a given. This pandemic is stressful. What about other psychiatric disorders? What are the challenges in treating them? And is there any increase in other forms of psychiatric problems with the pandemic?
Yes, there is. So there is an increase incidence of substance use, alcohol and drug disorders, as a result of the pandemic and also as a result of social isolation. So we've seen an uptick in the incidence of substance use disorders. People who have a pre-existing mental disorder, such as schizophrenia, may have increased stress due to social isolation, lack of contact with supportive family members, and poor adherence to medication recommendations. So in going off medication, they're more likely to suffer and have a bad outcome. We know that traditionally in the United States, roughly 1 in 5 Americans suffers from a diagnosable mental disorder. And about 1 in 25 Americans actually has a serious mental disorder, such as schizophrenia, manic depressive illness, or severe depression. We also know that some disorders have increased during the pandemic. For children and adolescents, about 1 in 6 children suffer from a diagnosable mental disorder. And children in general are unlikely to seek treatment, and only about 20% of children with mental health issues are actually receiving adequate treatment within the United States.
So it might be harder to just find these disorders because everything's been interrupted. Normal visits are now virtual visits, right?
Correct.
And so what do we do? What's the answer?
So one of the things that people can do to improve the resiliency is if you're isolated at home, first of all, you can seek social contacts with friends through virtual meetings as much as possible. The internet contacts make a big difference. Getting outside and taking a walk, as long as you adhere to a regular amount of social distancing, you don't even need to wear a mask as long as you stay away from other people. But getting outside and getting fresh air, also getting light exposure can be tremendously helpful. Getting a regular amount of exercise, and also knowing that if you're dwelling on thoughts of apprehension, worry, death, suicide, to seek help, to seek counseling. And to part of that is just good self-care.
All right. Well, thanks, Dr. Brown, for being with us. Is there anything else you'd like to add or more advice you'd like to give?
No, but it was a pleasure talking with you today.
All right. Thanks for being on the show. If you or a loved one are experiencing any of these symptoms, please reach out. Call the National Crisis Hotline at 1-800-270-0041. Or for Thurston County residents, call 360-586-2800. If you have any suggestions for something we should cover, please send me an email, rkam@tcmedia.org. Stay updated with Thurston Community Media, and stay safe, Thurston County.